Welcome everybody. We're so excited to have you to our second webinar in our series celebrating Botox today. Happy birthday to Botox. So what's the fuss? Do you feel like everyone is either getting Botox or talking about Botox? I know it used to be so taboo back in the day, and now it is just something that's so common. Are you a Botox lover and maybe you're only getting one area treated and you want to know of other areas that you can do? Is your forehead starting to look like this, or does it look like this now and you want to know if there's anything you can do? Well, you're here at the right webinar. So let's dive in and let's take a deeper look at what Botox has done over the last 18 years and what it can do for you. So today's purpose, we're going to celebrate Botox and learn what all the fuss is about. What exactly is Botox? How does it work? Where can you inject it and how much do you need? How often should you have treatments? What you can and can't do after Botox. We're also going to talk about Allergan's Brilliant Distinctions program and how you can earn rewards on getting treatments like Botox, dermal fillers, and even getting your Latisse. And then what everybody wants to know is how you can earn free Botox. Yes, you heard me right. You will be able to get free Botox. So we're so excited to have you. I'm just going to introduce myself for a moment. I'm Brianna Kane, and I am the Aesthetic Practice and MediSpa Manager. I've been with Aestique for about 12 years and having so much fun. And I want to introduce Nadine. Nadine is our physician assistant. She is celebrating her 19th year with Aestique right now. And just to give you some fun facts about Nadine with Botox, she has injected over 10,000 patients. 10,000 patients. Think about that for a minute. And that equates to over 300,000 units. We just looked this up and it's such a mind-boggling number and it's amazing. So you know you're in the right place. You've got a great expert here that's going to be sharing all of her secrets with you.
Thank you, Brianna. That is a lot of Botox over the years, but it's so popular. So that's why we're going to take right now, we're going to take the time to go over some things about Botox since it does have a birthday. So the reason we're saying that is that Botox Cosmetic was FDA approved on April 15th, 2002 for cosmetic use. Now, interesting, Botox, medical Botox, had been used for about 10 or 15 years before that and still is. But for cosmetic use, April 15th, 2002. It's also the #1 selling botulinum toxin in 98 countries. And to date, more than 100 million vials have been sold. And that is a whole lot of Botox. So it's very popular, and the popularity of Botox continues to rise every year. So I want to tell you now how Botox works. So although when someone comes in with lines or wrinkles, I'm definitely looking at their lines and wrinkles, but when it comes time to inject the Botox, I'm actually injecting into a muscle. So the big thing to remember about Botox is what is the underlying muscle doing? How is it pulling or creasing that is making the surface wrinkle that you see? So Botox is injected with a needle. It is a very small needle, probably one of the smallest needles in medicine that you'll have poked into you. It actually works at what's called the neuromuscular junction. It's an area in the muscle where a chemical signal allows you to use that muscle. So the Botox, the medication, actually kind of blocks that. And when it does, it creates a paralysis of the muscle or a significant weakening, depending on what my goals are. You can start to notice that Botox is working in a few days. Most people say within maybe 2 to 5 days, they can feel the area feeling kind of stiff or tight. It just feels different. And then peak effect is around 10 to 14 days. And Botox should be given for best results about every 3 to 3.5 months. But I also give the window of repeated treatment at every 3 to 6 months, depending on the person's age or what kind of results they want. But for the person who's looking for Botox to do the very best that it can do, it's every 3 or 3.5 months. So I wouldn't be me if I wasn't really technical about something. This photo here is the musculature of the face. We kind of just took the skin off and wanted to show you that this is where the Botox is actually going in order to create softening of your wrinkle or line. So if you look at this diagram, Around the upper part of the face, from like the nose or the eyes up, is the main area that Botox is given. The number one spot Botox is given is right here in between our eyebrows. There's actually two very strong muscles. So on here it's labeled glabellar complex. Two very strong muscles that actually come together left and right and pull the skin together. And that's why it creates vertical creases. That is the first place Botox was ever approved. And it's probably still the number one place that I inject alone, are the vertical lines in between our eyebrows, because they do tend to make us look tired or angry. The other two areas that are FDA approved and most commonly injected in the upper face, that bigger muscle called the frontalis, that's our forehead. There's two of them, one on each side. They allow us to raise our eyebrows. When we raise our eyebrows a lot, we create horizontal creases of our forehead. That's another area that we treat. The third area is that orbicularis muscle around the eye, sort of like a little donut that goes around the eye. And we are able to treat anywhere from the end of your eyebrow, a small arc down to the cheek for Botox. So those are the actual muscles that are being treated. Small one across the nose that certain people, when they smile, when they laugh, they kind of crunch up their nose and they make what we call bunny lines. That's another area that can be treated. And then around the mouth, we use low dose Botox. We're not trying to paralyze or even significantly weaken. We're able to use Botox in this area to just make a few little tweaks, because we don't want to take movement away. We just want to slightly modify it a little bit. So there's three areas. The upper lip area, it actually has a very strong muscle that goes the entire way around our lips. And people who purse their lips a lot make vertical, deep vertical lines. We can put low dose there and at least decrease their tendency to do that. Here on the chin, sometimes as we age, we get a like an orange peel wrinkled look to our chin. And just by putting a little bit of Botox there, we can help soften that. And then over here, there's a muscle that usually as we age, but every once in a while I see it in a younger person, it just sort of wants to pull down. It's tighter, it's being flexed, and it's pulling the corner of the mouth down a little. So again, a low dose there. And then that third one back by the ear, or the next one back by the ear, I'll talk about in the next slide. So here are a few other areas that Botox is used besides in the face that I just showed you for lines and wrinkles. The first one is for migraine headaches. Medical Botox received FDA approval a number of years ago now to help with migraine headaches. I have actually seen probably at least 50% of my patients who are getting Botox for cosmetic wrinkles of the upper face. At least 50% of them have a significant improvement in their migraine headaches. And I'm not even injecting it exactly in a way that treats migraines. If someone has severe migraines and they really need a referral, I will send them to a neurologist for the Botox injections, very specific for migraines. Second picture is someone clenching their teeth. A lot of people do that at night. They either clench or grind. It's a couple really strong muscles back here. A little bit of Botox can be put in what's called the masseter muscle. It's kind of what lets us chew, and that can also soften that muscle a little, and it decreases TMJ, the temporomandibular joint problems. So that's another spot. And the third picture is very popular with patients who have excessive sweating, which is known as hyperhidrosis. That is a very significant problem for people. This is not just someone who sweats, because we all sweat. We all have sweat glands under our arms. But this is someone where it's extremely excessive to the point when they sweat, their clothing becomes wet. They actually have sweat stains down from their armpit down even to their waist. It is excessive sweating. It interferes with work and social activities. So this person can be treated with Botox. This is a little different. It's not going into the muscle. This is probably the only time I don't put it into the muscle. This is going much more superficial where the sweat glands are. And in this particular case, Botox blocks, again, a chemical signal that allows us to sweat. So a number of small injections are done, very similar to that diagram under this person's arm, of Botox. And the nice thing about this is it can last 6 months where the patient has 95% reduction. These are some of the happiest patients I've ever treated. They come back and tell me that it is life-changing for them because it has stopped that liquid sweating that they have. So that's something that it's used for quite a bit.
And I'd love to vouch for that. I have had that treatment done and it is life-changing. It's amazing. I could only wear dark clothing. And then after doing this, you can wear whatever you want. And also something to note on this too is you do get to put some BLT cream, which is a numbing agent. So you're not getting poked with the needle a bunch of times in your armpit. You hardly feel it. You may feel, for me, 2 or 3 little pokes.
Right, because Brianna, there's like 25, probably for that particular site, there's probably a good 20 or 25 needle pokes. But you are quite correct. Most people end up saying they felt 2 or 3.
Life-changing, especially with summer coming up.
So let's talk a little bit more about Botox. Like I said earlier, it is done with a needle and a syringe. It probably takes about a minute or 2. Very often I get the question, does it hurt? Well, I do have a needle in my hand, so you're bound to feel something. But comparing it to other procedures that we get, even like a flu shot or having blood drawn, this is significantly less. And it takes about a minute to do. So what most people say is on some of the places where I inject, they might feel a pinch. They might feel a slight burning, but not everybody feels that. But almost everybody at some of the injections hears or feels a slight crinkling sound. That's the best way I can describe it all these years. It makes a small noise, and that's simply that tiny needle going into the muscle. It does not make it hurt more. Some side effects. Some things that I see are bruising, bumps and tenderness, and maybe a headache. Bruising is not as common as you think. You think that every patient that I'm sticking a needle in might bruise, and that's just not the case. Of the 3 main areas, in between the eyebrows, the forehead, and the crow's feet, definitely the crow's feet is the area where I sometimes see like a little bluish yellow bruise. It is not like a black eye. I've seen that once or twice in 18 years, but I have never seen it common. It's more just like a little bit around this delicate skin around the eye that you can see a small bruise. Bumps and tenderness, sure. Some people say that night when they wash their face, it's slightly tender and it's gone by the next day. And headaches, I would say maybe 10% of the people feel a headache, and it's never right away. It's usually in the evening afterwards. Nothing at all to worry about. It's simply that muscle that just spasmed a little. Couple other reminders always after Botox. Don't raise your heart rate for 48 hours. So that means no going to the gym, jogging, high impact aerobics, things like that. And nothing that anyone else would put pressure over the areas where I injected, such as facials, massages, or eyebrow work. One last thing to take note on this page is, please remember everyone's journey with Botox or anything cosmetic is different. Even though you have an idea of what someone else had done and their result. Remember, you might be starting at a different point than them, have different physical features. So everyone is slightly different.
You know, we do have some patients that'll ask and say, if I come in and I get my Botox done, will it be noticeable afterwards if I'm trying to not let people know that I had it done?
Oh, great question, because that is something people ask quite often. What you can see from Botox, especially when you're leaving the office, is it will look a little bit pink. I won't even say red. It'll look a little pink, and you might have a few tiny bumps that really do look like mosquito bites. That will last for about 15 minutes. Almost everyone, it's gone by a half hour. So Botox definitely is something that you could have done at lunchtime and meet your best nosy girlfriend for dinner, and she would not know. But if someone saw you, if you immediately went to the store, you might notice it within 15 to 30 minutes, but not the rest of the day. So this brings me to talking about the word Botox. Botox is a brand name. So we do use Botox Cosmetic by Allergan Pharmaceutical. It is the one that we're talking about that has been FDA approved since 2002. we placed a picture here of a couple other products, Xeomin and Dysport, that came out 7 or 8 years ago. They are competitors to Botox made by different pharmaceutical companies. They are botulinum toxins too, with basically the same indications for treating upper face lines and wrinkles. But they are not all exactly the same. So many patients, but also practitioners who are giving Botox across the country, are using the word Botox generically. So sometimes when I have someone come in as a new patient and they said they had so many units of Botox, or the Botox, you know, they described where they had it and what kind of results, I'm never quite sure that they actually had Botox brand name. So we do use brand name Botox at Aestique. We feel that it is a superior product. We've used it for so long. When these newer products came out, we tested them, did it on a whole lot of employees, but we just came back to Botox, and we've always stayed with it. So you always have the ability to ask the practitioner what product is actually being injected. The Botox box is pretty noticeable with the purple coloring, and even the vial is pretty something that you would recognize. So always ask what product you're having injected. We do use brand name Botox at Aestique. I really like this slide, so we included this in here. The first thing it does is reiterate the main areas that Botox is given, the go-to areas. The number one area, the 11s between our eyebrows, also known as the frown lines, the crow's feet, and the forehead. Really across the bottom of the screen, there's also some pretty cool statistics as well. 7.2 million is the number of patients in the United States who've had Botox. That is a lot of Botox, because I remember when we first got it, I remember when we first got our first shipment in of Botox, and no one really knew what it was. A lot of patients were very skeptical the first year or two, but every year since 18 years ago, the number of patients getting Botox has increased. Second statistic here, 14% of the patients getting Botox in our country are men. So it's not a great percent, but it's interesting that that many men are getting it. And 44% of patients in the US are under the age of 45. A lot of people think that Botox is for severe wrinkles or an older patient, but I'm finding that a lot of younger patients are starting before they have the deep lines, which is absolutely ideal. So if you ask me what would be the perfect age to probably start Botox, it might be 30. Early 30s might be a great age to start Botox. The next slide that we're going to show is a video. This is Katie, which is one of our estheticians in the Greensburg Medical Spa. Katie is getting Botox in two areas: the vertical creases between her eyebrows, which is what the video is showing right now. There's usually 5 needle pinches there. And then I have her raise her eyebrows before the forehead injections. These are treating the 2 larger muscles that raise our eyebrows and create horizontal lines. That is usually about 4 to 5 injections. So total, she had 9 needle pinches, and it took about a minute to do that. Which leads me to some before and afters, which is what's always very dramatic. The first patient on the left, I think, yes, we posted these for the forehead lines, our horizontal lines of the forehead. This patient had pretty significant deep lines. I can see 1, 2, 3, 4, 4.5, 5 lines horizontally across her forehead, with a couple of them on the left side of her face, very deep. So 15 units of Botox was injected into that frontalis muscle that moves it up and down. The after photos are generally at about 2 weeks or 3 weeks. And that is because Botox reaches its peak effect at 10 days to 14 days. So her after photo on the right was taken at about 2 weeks. And you can see that probably 90%, 95% of that movement, that creasing is gone. I can still just see a tiny bit in the center, a couple light horizontal lines, but that's a very significant improvement. The second one is very similar. Horizontal lines, raising the eyebrows across the forehead. That was done with 15 units as well. and a 2-week photo after. I like to, for this particular area, my goal is not to 100% paralyze. This area I like to significantly weaken so that when the patient is laughing or talking, they can still slightly raise their eyebrows, and it's a much more natural look compared to 18 years ago. They were telling us much, much higher doses to use. Since then, I've significantly lowered the dose. Then on to what we call the glabella. That is the frown lines in between our eyebrows, in case you hear us using that word. The first patient is Katie. That's the person you saw the video of. She has pretty strong muscles in between her eyebrows, so that when she tries to pull them together, she's creating one really deep line on the right. 20 units of Botox was placed in that area, 5 injection sites, and the photo taken after shows that she really can't move that. In this particular area, I am trying to paralyze it completely. That is my goal. The second photo is someone who has deeper lines and actually has a good 11, 2 parallel lines, as well as you can just see some tightening, like the muscle actually pulling quite a bit from each side. And then afterwards, very smooth look to the skin, and she's unable to make that frown or that angry look. Our third area is the crow's feet. Very common area to do, and most people pick these up when they're doing selfies. And this area is that muscle that goes like a donut around our eye. Both top pictures is a male and a female when they're smiling. So you can see the significant creasing that takes place in that muscle that creates the crow's feet. They're both pretty deep. Both of these patients are in their 50s. The after pictures, which are on the bottom, the first patient, the man who happens to be my brother and agreed to let me use his photo, that was after his second treatment. And the patient on the right, the female, is actually after just 1 treatment with Botox. The crow's feet, the most common dose I ever use is 10 units per side, but it could be anywhere from 5 to 12 units per side. So I did mention earlier on that one slide that we sometimes use Botox below the eyes, but we do use low dose Botox. So this is an example of a patient that had really significant upper lip lines that concerned her. They're pretty deep and they extended pretty far up into the white part of her lip. So when I first saw her, I told her that dermal filler alone, which is another product that goes into the soft tissue, dermal filler into her lips, it was not alone going to improve them the most. So I suggested using a combination of Botox for the muscle that goes around the mouth, as well as dermal filler into the pink lip. So a very low dose, 5 units for the upper lip, which is 2.5 units per side, was injected 2 weeks before the lip filler. So sometimes one particular procedure is not the answer or is not going to give you the best results. In her case, I was able to combine Botox and filler to get a nice result.
That's such a beautiful result. All of those photos, great before and afters.
Thank you.
We do also know that it's not just the injection. There is some other stuff that we can do to help our skin be prepared for the injection. So I'll let you talk about this.
Thank you. Yeah, Botox is a wonderful procedure, but it really does hit just certain very specific areas of our face. But that doesn't mean we still can't have thin skin, not enough collagen, pigmentation. So good skincare is one of my favorite things. In fact, I'm very passionate about skincare with patients. We carry the ZO Skin Health medical grade skincare. It's the only skincare line that we carry. I cannot stress enough that if you're in for treatment and getting Botox, I will almost always bring up some degree of skincare. Even if it's crow's feet you're having treated, I will suggest a medical grade skincare that goes right for the eye. But I really like to get patients on skincare that is for their entire face, for anti-aging. So when you are thinking about coming in and what you're interested in, consider this as well, because it's such an integral part of the anti-aging that helps everything else, whether it's Botox or dermal fillers. It helps everything else look better.
Thank you for all that great information, Nadine.
You're welcome. My pleasure.
Now we're going to jump into the Brilliant Distinctions program that Allergan sponsors. Allergan is the manufacturer of Botox, and they have this great program that we can offer complimentary to all of our clients. And what it is you will get rewarded for every time that you have a Botox treatment, you have a dermal filler treatment, or even when you buy Latisse. So if you look down here, you'll be able to see how you can save with Brilliant Distinctions. And just to give you an idea, every Botox treatment gets you 200 points. So right here, you'll see that's $20. So when you come in for your next Botox treatment about 3 months later, you'll have a $20 coupon on your account that you can use towards your purchase. Now over here, it is free to join. It'll show you there is an app on the Google Store. There's also an iPhone app. You'll get 100 bonus points as soon as you sign up. So that's already $10 off your treatment. It's super easy to use. We love helping clients in the office be able to, if you have questions about it or want to learn more, you can go to brilliantdistinctions.com or feel free to ask us. We would be happy to help. So now on to the special offer. So we're really excited that we were able to share all of this information with you, and we have a really great offer to be able to provide you with. Normally, our Botox is priced at $15.25 a unit. But for attending this webinar, you're going to be able to pre-purchase your Botox for $13.50, which is a phenomenal, phenomenal price. That's not all though. If you purchase 30 units, you'll get 10 units for free. So just to put that into perspective, if you're someone that gets your forehead and your glabella treated, and you're thinking about, I kind of have these lines here and I want to try it, but I'm not sure, those 10 free units, you could use it there and try it and see what it's like. So it's $405 for that package, and the value of it is $610. So an amazing deal. But that's not all. You could purchase 40 units and you could get 15 units for free. $540 is that package, and it's valued at over $830. And lastly, you could purchase 50 units and get 20 for free. That is 70 units of Botox for $675 when it's normally a little over $1,000. Such great deals. And we're so happy that we can be able to offer that to you, and I hope you take advantage of it. So couple things. The purchase must be made by Saturday, April 25th at 5 p.m. You're probably wondering, oh my gosh, I need to do this right now. How do I do it? Well, there's a couple different ways that you can do it. You can either screenshot or take a picture of this page, and you can go to our landing page and purchase directly, which you'll see the link right here. You could also email info@aestique.com, and we would be happy to help you. Or you can call our spa at 724-832-8266. So either one of those ways, as long as you have it in by 5 p.m. on Saturday, we would be happy to take care of you. And if you do have questions, we would be happy to answer those for you as well. These would be banked on your account. So say you bought the 70 units, you would have the 70 units sitting on your account. It does not expire. So you can then come in, meet with the injector and decide kind of how you want to use it. So speaking of injectors, we have such a great team. We have 3 phenomenal injectors that are completely educated, always continuing their education. Of course, Nadine. She's done over 300,000 units, so you are in very good hands with her. And she's in our Greensburg spa. Maria's the nurse practitioner that works out of our Shadyside spa. And we also have Marianne Woody, who is also a nurse practitioner, and she works with our plastics practice. So she goes to both locations as well. We also have something super exciting to tell you. We host Botox parties. Typically, we do it in the office, but since we are in this social distancing part right now, what you can do is we can do it virtually, and we can have you invite a group of your girlfriends or whoever you want, and you'll send us an email, info@aestique.com, to sign up for it, and you can actually go live on something just like this. And you can learn all about Botox. It's like your consult. So when you're ready to come in and have treatment, when our doors reopen, if you bring 2 new friends, you'll save 25% off your treatment being the host. If you bring 3 new friends, you'll save 50%. And if you bring 4 new friends, you'll be able to get up to 40 units at no cost. So it's an awesome way to get everyone together, have kind of like a casual consultation with one of the injectors, and it's fun. It's a lot of fun. So heading over to what else we're doing, we do have a Mother's Day webinar next week. It'll be on Thursday, April 30th at 1 p.m. And Michelle is the manager at the Greensburg Spa. We're going to be talking about best gift ideas for moms, some trendy ideas, and we package it really nicely. We can deliver it to her. We can also ship it. So please sign up for that. It's a lot of fun. The link to sign up is on the bottom, but you'll also be getting that in a thank you email as well. And our surgeons, they are also kicking off a webinar series. Their second is going to be on Tuesday, April 28th at 1 p.m. And they're going to be talking about skin lumps and bumps. Should I be worried? This was so great. I hope you enjoyed your time. And I will let Nadine, if she has anything she'd like to close with before we finish out.
No, I just want to thank everyone for attending and for following us and being part of our practice. We miss all of them. Hope they're safe. And we'll get back to normal soon. Everyone will get their Botox. So just hang in there a little bit longer.
Well, thank you so much, everybody. We're really excited that you joined us. Please follow us on social media if you do not already. All of our links are here. We have Facebook, Instagram, and our YouTube channel. We're putting out new content almost daily for you on all of that. And hopefully we'll be able to open soon. So stay tuned. Thank you so much for joining us, and we hope we help you live life counterclockwise.